Monroe Hospital selected Byotrol on an ongoing opportunity for a partnership in healthcare. And that means due to the outcomes that we've seen, being able to prevent hospital-acquired infections, we've realized Byotrol is our choice for a partner.
We use Byotrol products in 3 ways. We have a hand sanitizer for our public areas to get visitors coming in to do hand hygiene. We have wipes that we use to wipe our patient beds down on cards to disinfect them. And then we have them in an overall spray bottle as a surface protectant that we go back and staff cleans door handles and keyboards and light switches and bed rails and those type of devices, trying to put that protective barrier on high-touch surfaces. Our first results that we had was in our lab study. I was skeptical on it being what it said that it did, so we grew MRSA and VRE in our lab, used the Byotrol products to kill it, and then re-inoculated the surface for 3 days and never received any growth out of it. And so by keeping that superorganism gone for 3 days, that was all the evidence I needed to say it worked. And so then we started using it in the hospital on a weekly basis. And as we started using it, staff started seeing that it's easier to clean because nothing adheres to the surfaces that it's on. And so your work product becomes easier. You can eliminate acid bowl in your strong cleaners, and then just the overall target that we have in our infection prevention program is 0 infections. And for the past 2 years now, I can't document any hospital-acquired infections in MRSA, VRE, or C. diff. The comparison with a conventional disinfectant is that once you apply them, like a bleach or a Lysol or an Ecolab product, that once they dry, they're gone. With the polymer backbone of Byotrol's products, it fills in the micro cracks and crevices and on surfaces, and then it holds 2 biocides that are attached to the backbone, is held onto the surface longer. And so when you look at conventional, it dries, you come through and touch it, sneeze on it, you recontaminate the surface. With Byotrol products, the biocides are on the surface. If you recontaminate it, there's still disinfectants there that are killing the microorganisms. So essentially nothing can attach to the surface of a Byotrol coated or treated area. Well, the biggest impact is financial. The Centers for Disease Control estimates a hospital-acquired infection to average about $27,000 a day. And so by not having any hospital-acquired infections, we save our bottom line, and in turn we save the patient's healthcare finances because we're not increasing in the illness area. The second part comes in the operations savings because we're able to reduce chemicals and we don't need the harsh cleaners, and we don't spend as much time cleaning particular areas now. And so financially you save by eliminating products. I think what hospitals can take away from what we've experienced here in the past 2 years is that you can achieve the 0 target of hospital-acquired infections. You can reduce your overall operating expenses by decreasing the amount of labor that you take in, the amount of products that you need to clean with. And I think hospitals can promote education to the public about transmitting diseases and how important it is to sanitize your hands when you come in and wipe down the surfaces as you're in the room visiting or as you leave. So I think hospitals can use this technology to help them switch from those control mindsets to a prevention mindset and really go after that 0 rate.
Where I think it's important, where Monroe Hospital and Byotrol have come together in this partnership, is that we really have to concentrate on healthcare economics. We cannot be allowing the patients who come to us for treatment get sick while they're at the hospital. And accompanied along with excellent hand hygiene, with excellent education for the caregivers, is extremely important, and that's why we think Byotrol is the best partner.